The research that we are conducting through the Jameel Institute RISE program is the most objective account and most scientific and unbiased account of the conflict escalation in the Gaza Strip since 2023. I'm Paula Christen. I am a postdoctoral researcher funded through the Jameel Institute RISE program. I'm currently on a secondment with the World Health Organization to understand what the actual number of deaths are in the Gaza Strip since the escalation in 2023. The Jameel Institute RISE program has served as a foundation for the damage and needs assessment that most recently took place. The work focuses on how mathematical modeling evidence can be used in humanitarian contexts and crisis settings. It helped to understand what the baseline requirements are to serve the population in Gaza and to respond to the public health needs, both the chronic diseases as well as infectious diseases that the population is experiencing. The one stream of work is a literature review of all of the evidence that has been developed during responses over the past 10 years in different crisis settings. The second stream of work is the mathematical model that I'm developing to understand the different causal pathways between the determinants of mortality and how they relate to one another. And the third stream of work is a focused analysis of the traumatic injuries that have been observed over the year of 2025 to understand whether this increase was statistically significant and can be attributed to the aid distribution. Beyond violent causes of death, we also observe death due to non-violent causes. For example, having no access to healthcare services, to nutrition, to water and hygiene practices. Together, these streams of work help in informing how public health situation analysis can be conducted. Of course, no crisis setting is the same. Gaza versus Sudan, they have very different epidemiological profiles to respond to. However, the determinants that the framework probes on helps to understand the critical data needs and how this data can then inform response plans and recovery plans. Scientific research, in the way that we are doing it in the Jameel Institute RISE program, enables an incredibly objective and robust way of looking at a crisis setting, piecemealing all of the different data streams together and building a profound understanding of a crisis situation. We are developing evidence that is useful for the WHO to run their operations on the ground. So that is resource allocation decisions, those are public health situation analysis, which can inform what actions to take next in the humanitarian response throughout the escalation and also in the recovery planning stages. As more evidence becomes available through the Jameel Institute RISE program and the WHO collaboration, similar tools and evidence should be developed for different crisis types, which require a response and a humanitarian action that can be done in a lot more evidence-informed way. I hope that this enables more intelligent and data-driven humanitarian response planning and decision-making process.